हाँ भाई, तो ये बताइए, what is the first thing that you will do when you see a patient and on his x-ray you see there is some radiolucent pathology in the jaw and you suspect that it is either a cyst or a tumor? What is the first thing that you will do? After you have done the clinical examination of the patient, you have seen that there is some buccal expansion, whether there is lingual expansion or not, and whether there is raise in temperature, whether there is any lymph node, lymphadenopathy, which is caused by the pathology. So first you do your clinical examination. Then you do your x-rays, you do your OPG, your CT, whatever you feel is required. Alright? Then the next most important thing that you will do to come towards your clinical or working diagnosis is aspiration. Okay, again the same water balloon. Imagine there is a cyst or a tumor in the mandible, and clinically you have to judge what it is. One of the easiest ways, unless you are expecting a vascular pathology. In vascular pathologies, you will never try and aspirate. Otherwise, in all other pathologies, you can just put a needle and aspirate the content. If there is a straw colored fluid which comes out, you are quite sure that it is either a dentigrous cyst or maybe a dentigrous cyst which is very long standing, can be converting into ameloblastoma also. If there is some cheesy material which comes out, it could be an OKC. If there is frank pus which is coming out, it can be an infected cyst. And if there is frank blood which is coming out, then it's a very, very vascular pathology. Could be CGCG, could be a vascular lesion. Alright, so aspiration in any radiolucent pathology of the mandible or maxilla is the next clinical step which you will do before biopsy.